Hello, thank you for joining me this week. For those of you who are not familiar, my name is Megan. I'm a grad student at Grantham University. I'm completing the week 6 assignment for CO101. I'll be talking to you about pertussis and the DTAP vaccination, which is the most common defense. The 100-day cough, a primarily preventable bacterium, puts half of all infected infants in the hospital. That's worldwide. Sounds like sci-fi. Unfortunately, it's true. Despite the success of the pertussis vaccination, commonly known as DTAP, many adults are not immune and are infecting the infants they're closest to. Bordetella pertussis is only passed from human to human in what's called shared breathing space, so about 12 inches out from your mouth. That puts young babies and loved ones at the most risk, since those are the ones you're getting closest to. It's also a sneaky bacterium. It's most contagious prior to those telltale symptoms of coughing. Nicknamed the 100-day cough by the Chinese for its long period of recovery, pertussis is a serious disease. For those of you with underdeveloped or weakened immune systems, it can be absolutely devastating. The Bordetella pertussis bacteria infects the cilia of the lungs, where it spreads toxins and poisons, killing the surrounding lung tissue. As the lungs try to expel the poison, the body begins racking coughs. In an adult, this may seem like a particularly yucky cold. An infant, however, is unable to cough, sneeze, and expel the mucus. The inability to breathe easily through the nose limits the ability to nurse or drink a bottle. The same phlegm that blocks the nose affects oxygen income into the lungs, forming a lining around the lungs. This inflammation in mucus leads to lower oxygen levels, further starving your small child of the necessary tools of life. The difficulty in breathing can lead to apnea, a pause in breath cycles, which can be life-threatening in very young infants. In fact, it can be a cause of SIDS, sudden infant death syndrome. As severe as the coughing can be, sometimes even cracking baby ribs, most infants do survive pertussis with adequate and prompt medical care. Half of the diagnosed patients are admitted to the hospital for the suction of airways, breathing treatments, bronchodilators, and oxygen, followed with antibiotics and intravenous fluids to help the baby to heal more quickly. The quick treatment from a medical professional and the immediate use of the proper antibiotics is going to be crucial in drastically reducing the spread of the bacteria within the lungs and cilia to evade the worst of the symptoms. If it's believed an infant has been exposed to pertussis, whether or not mom has been vaccinated, it's extremely important to seek medical professionals right away. In the 2 weeks before coughing occurs, parents are advised to speak to the pediatrician about potential symptoms and bring in the infant for an exam. If any occur, or if there's a fever, they're asked to take the baby back. If the infection has lasted more than 3 weeks, however, antibiotics will no longer have any effect. The damage has been done to the cilia, and the patient must endure the long coughing episodes until the cilia have had time to heal and the lungs can process oxygen again. Though the prognosis can sound bleak, it doesn't have to be that way. Thanks to passive immunity, an unborn fetus can be protected by the time of birth. If mother decides to vaccinate herself during her 3rd trimester, between weeks 32 and 36, it's recommended to get the DTAP shot, which protects the baby against pertussis when it's born. The mother may also further supplement this immunity by breastfeeding the baby and exposing herself to the baby's shared breathing space. That natural urge to kiss the baby's forehead and all around its face actually sparks her immune system to fight the baby's battles. However, once the baby is infected with the pertussis disease, it has a long hold. The initial contagion is only 2 weeks, but the healing process to follow can take 8 to 10, and that doesn't even count the 2-week period, which is most dangerous and a hospitalization typically occurs. So you're looking at up to 14 weeks of your baby being sick. That's a huge deal in a 14-week-old baby. doubling its lifespan. There are, at this time, no long-term correlated effects such as asthma or autism for young survivors of pertussis, but they're not sure that it doesn't cause it either. So this is a completely devastating disease, which we could, as a medicated country, completely avoid by vaccinating ourselves and our children. It's all up to the parents to make the choice at this point, though. I hope that you've learned a little something about either pertussis, Bordetella pertussis, or the DTAP vaccination, and have a lovely day.